right, thank you for listening to our newest episode of Autoimmune Community Voices. Today we're pleased to speak to Cindy and Catherine of Global Health Literacy Outreach. They are here in the San Diego area also, and they reached out to us recently to talk to us about collaborations and health outreach and health education. So it's just we're really excited to have the opportunity to continue the discussion about autoimmune disease globally, global health, and how to continue health education. So welcome, Catherine and Cindy.
Thanks for having us.
Thank you. So please tell us a little bit more about you and about Global Health Literacy Organization.
Yeah, we're excited to be here. So my name is Cindy Lee, and I'm a rising senior at Canyon Crest Academy, and I'm the executive director and the founder of this organization. We've been having this organization for about like a year.
Yeah, and I'm Catherine. I'm the director of outreach for this organization, and I'm really excited to be here as well.
Okay, wonderful. So tell us a little bit about how GHLO, Global Health Literacy Organization, got started. How did you come up with this idea, and how it's been going?
So I actually co-founded this with a friend who is right now in China. So we both kind of grow up in a family setting where kind of like traditional medicine is valued, and then also my family, one of my family member, she actually have diabetes. So growing up, I felt like I've been influenced a lot by her, like teaching me how to be like healthy. And there's actually this one television that she like show that she liked to watch, and it teaches you a lot about how to be healthy, how to like stay healthy. And I felt like this is like a lot of people today, they don't have this awareness of how to be healthy, and they don't have the information about how to be healthy. So this is what we want to address, and this is kind of a common interest that got us to start this organization. And last year, so we finally decided to like put things into action. So we started this, I think last year around August-ish, so yeah, about this time. And so I've also like further like to do a little bit more like statistical research into like how many people are actually influenced by this. So what I found is that only around 12% of Americans have proficient health literacy levels.
They have, what do they have?
Proficient health literacy levels. So yeah, so the definition of health literacy is to be able to obtain, process, and understand information. And I think every day that we come into a lot of contact with those information, whether like reading a drug bottle, or to like just going to the hospital for like a physical checkup, there's a lot of information that we're receiving, but a lot of them we're not really understanding them. Yeah, you can imagine that, like a lot of chemicals on the drug bottle, or like imagine like you have like the instruction sheet and it's like all crammed up and you just don't want to read it. So I think there's a lot of things that we're kind of like just like overlooking them, like we're not caring about them. And then I felt like this is something that we really want to address.
Yeah, thank you. Yeah, and that makes a lot of sense, because those packages, the side effects, the whole like sometimes they even give you like the organic chemistry like structure, and the documentation is like, who really reads all this, right? There's just so much stuff there. Yeah.
And then a lot of them, because of this like lack of knowledge, they end up in emergency room, and we really would like to prevent that from happening, because there's a lot of people in emergency room. First of all, like there might be like not enough time for you to get like very immediate like care. So this is like something that we can do like as an individual, like to prevent these things from happening.
I agree. Yeah, things like drug interactions, those sorts of issues, right? People need to have communication, be aware, and then also be in communication with their care team to make sure that people are aware of all the different medications they're taking, any allergies, any interactions that could be a problem. And so, Catherine, tell us about how you got started.
So I actually joined.
See us? Okay.
Yeah, I actually joined this organization like earlier this year because I found out about it on a school like club fair, and I was at that time really interested in global health as well. So yeah, I was just like looking into what they do, and it sounded really interesting. So I signed up and started working with them, and it's been great ever since. So yeah.
All right. So tell us about some of the events and activities you've been doing.
Some events. So we kind of divide our organization into kind of different departments. So each department have their own focus. So first we have education and cultural. So in this department, we specifically focus on like health fairs, health events, and we focus on our connection to the general public. So previously, there is let me think, kind of 4 activities that we held like to connect to the community. So last year during Christmas time, we did like a bake sale, and we have this focus on like mental health, like end of the year burnout. So we did a bake sale, and then we spread out some brochures to people, and it's been great. So and this year April we did a World Health Day. So so I think World Health Day kind of falls on April 7th every year. So this year we focus on maternal health. So we reach out to a lot of organizations or like clubs in our school, and we collaborated through this, and we hosted like a lot of like different like stations for them to like visit and to interact with, and it was really fun. And just I believe it's actually I think it's in June. So we did Alzheimer's and Brain Health Awareness Month. So we did like a Kahoot, and we put it on screen, and we have like people joining, and they can win prizes through that. So so we hold this event. We have like a poster about like a lot of information. We have some brochures that we pass out to people, and do this. And we also host this at our local library. So yeah, if you're local and we hold this in Pacific Islands Library. So if you're here, check it out. Yeah. So yeah, a lot of people will join and to talk to us about it. So it's been really fun.
That's wonderful.
Yeah.
Library outreach. That's a really great idea.
Yeah.
Yeah, there's so many ideas. I'm thinking about how we can work together. So I'm really excited to talk more about that after our conversation here on the podcast. But so Catherine, what have been some of your favorite activities and some of the things? Maybe you can talk about what's ahead.
Yeah, so we've been trying to engage more with specifically the autoimmune community, and over the past month or so we've been creating like little bookmarks and health guides. They're essentially health guides that have information on lots of different diseases, including autoimmune disease. So we also have like health guides on Alzheimer's disease, on mental health, on vaccination, and some other things. But for the autoimmune disease health guide specifically, we have put information about like what it is exactly, and what types of autoimmune diseases there are, and symptoms such as inflammation, and then healthy habits on how to like manage your symptoms in life with autoimmune disease. So one of our goals with this was at the very least to spread awareness about autoimmune disease, but also to help those in our community who may not have access to information as easily, and the support from our community. So that's what we were really trying to do. And we're planning to distribute this in like libraries and nursing homes and schools as well, if we can reach out to them. So yeah, that was one of my favorite projects we've done so far. And another way we're trying to engage with the autoimmune community is to like reach out to community members who are working with autoimmune disease like in their daily lives, such as people working in like research, nonprofit sector, like clinical settings, and just trying to give them the opportunity to tell their stories to in our organization, and just to have that reach to a larger audience. So that's one of our efforts that we're planning to do in the next coming months.
That's wonderful.
Just kind of adding on. So we also really hope that kind of we can address some like misconceptions about like the autoimmune disease community. And yeah, because I think that this is like not just a one-way effort, of this to be a two-way effort. So first, like people with this condition can be able to freely like express themselves and to share about their experience, and second, we can have the community be a more understanding towards this. Yeah.
Thank you. Yeah, so that's things like invisible illnesses and things like stigma. You know, I'm one of those people who have like a stigmatizing one. You know, so it's not that all of us can publicly like talk about their experience, because there's too many stereotypes and things that are very harmful. You know, and then also the disability community. A lot of us have invisible illness, right? So people assume that if you have a wheelchair, you're like pasted to the wheelchair, you can never leave the wheelchair. But a wheelchair is just a chair with wheels. It helps you when you need to sit down, you sit down. When you need to stand up, you can still stand up sometimes, right? Not everybody, but everyone's situation is different. So yeah, getting all those sorts of awareness pieces out there about what is disability, what is that experience, and it's not one experience, right? And some people argue that as we get older, everyone at some point will possibly be disabled, just based on health needs and things. But yeah,
and I think that's why it's so important to spread the awareness and the knowledge on just the basic information, because without understanding what people are going through, it's hard to like really empathize with them and their struggles. And I think that really speaks to our mission as an organization too, because like health literacy gives people the agency to make choices and decisions for themselves and what's best for them. And our mission was basically to empower our community with accessible and equitable like health information, and translating like scientific information into accessible information, like through communication and outreach. And yeah, I think it can be difficult to find support, like especially if you come from an underrepresented background, and you may not have that level of support. And I've personally seen this through my like journey with autoimmune disease too. So yeah, just trying to bridge the gap between science and the public is like kind of sums up our mission. And I feel like it shouldn't take a personal diagnosis to begin to care about this issue as well, because it impacts like so many people in our community. And to equip everyone with the knowledge is, I think, such a valuable thing that we're like so proud to do. Yeah.
I love that quote. I'm going to use that quote. Thank you. And in terms of like, reaching out to diverse communities, can you share again the languages that you can work in, the languages that you speak, the communities that you've been able to connect with?
So for me, I grew up in China, so I speak Mandarin. So we actually, as I talked about earlier, my co-founder Irish, we actually have a branch in China. We focus on more like online social media awareness of this, explaining like a lot of different health topics online. So I'm comfortable with working with like Mandarin and then English. Yeah.
Okay, that's great.
I can speak fluent Korean. I actually speak it at home. So yeah, and then I can speak like intermediate Spanish as well. So those are the languages for me.
So great. Yeah, so there are so many wonderful ways that we can collaborate, and I hope that others in the autoimmune community and in the global health community continue to reach out to you. But I'm really excited about the future and how we can continue to collaborate together also. And so tell us, how can people learn more about you, find out about the work that you're doing? How can they connect?
First of all, if you do live in San Diego, you can always like engage with our local events. So we're having a in-person event on August 29th, and it's on like vaccination and immunization. So it'll be at the Pacific Highlands Ranch Library at 4:15 p.m. So you can definitely check us out during that event. And for other people, you can also reach us on our social media. So we have an Instagram, a LinkedIn, and I think a Facebook page as well. And we'll be updating our website soon, and it's going to be published soon. So look out for that. And then the last way you can engage with us is to sign up for our Substack, where we publish like articles on global health topics. So yeah, those are some of the ways that you can engage with us.
Yeah. Also, you can also join us as a member, because everyone in our organization are so dedicated to advancing this health literacy. If there's something that you're passionate about, you can reach out to us through email, or we have a form for membership signing up. And yeah, we would really love to have any.
Be happy to welcome volunteers.
Yeah,
definitely. All right, thank you so much. And so both of you are in high school right now, right? So this is an effort that, regardless of your age group, you're welcome to participate in our movement for autoimmune awareness and for global health also. Especially if you are in San Diego, continue to reach out to us, and we'd love to collaborate. So thank you so much, Cindy and Catherine.
Thank you for having us.